Hello, I am Manon.
And I'm Haley.
And today we're going to talk to each other about bipolar 1 and 2. I have bipolar 1.
I have bipolar 2.
So you could call us experts. So, Haley, before you were diagnosed with bipolar 2, did your medical team try to diagnose you with anything else?
Yes. So when I first started experiencing symptoms, I went into therapy and I was discussing with my therapist about what's wrong, what's happening. We were a week close to getting me on antidepressants or something like that. And then I started coming in with symptoms of hypomania with elevated moods. I hadn't been sleeping. I had gone and impulsively gotten a tattoo and piercings and stuff like that, and just overall incredibly elevated frenetic mood and everything. And they were this close to putting me on antidepressants and diagnosing me with depression. And good thing they didn't, because when it comes to putting someone with bipolar disorder on antidepressants, there can be a negative effect that happens and can push you further into mania or hypomania because of the medication.
Yeah, I actually have a story that kind of elucidates that point. So I was diagnosed with first anxiety in middle school and then depression in high school. And I was on Zoloft for several years in high school and early college. And then I went into a facility for depression and suicidal ideation, and they thought, because what I was telling them was I was incredibly depressed, so they then added onto my dose of Zoloft another 50 milligrams of Wellbutrin. So I was on 150 milligrams of Zoloft and 50 milligrams of Wellbutrin all at once. And that triggered an intense manic psychotic episode. So, for our listeners out there, if you think you might be bipolar, don't go on 200 milligrams of SSRIs, because you do not need more serotonin in your brain. That is something I learned from my psychiatrists in and out of the hospital, is that serotonin is a big trigger for mania or hypomania. So, once you were diagnosed with bipolar 2, what medications were you put on?
They started me on lamotrigine, which is an anti-seizure medication as well. But they started me off on a low dose of lamotrigine because they want to titrate you up. I started on 25 milligrams. I am now on 300 milligrams. And they start by titrating you up slowly. Every 2 weeks I'd go up another 25 or another 50 until I reached, at that point, 100 when I was first diagnosed. That managed my symptoms and stabilized my mood and everything. I've only ever been on lamotrigine, and thankfully that's the one medication we started with, and it's the one that has been working for the past 4 years.
That
super lucky.
Is so
super
great.
Lucky.
That is so great. And so you were diagnosed at age
18.
18.
That's when, because the age of onset is, you cannot be diagnosed with it before you are 18, and the age of onset is around that age as well.
Yeah, late teens, early 20s.
Yeah.
Yeah, I was diagnosed at 20. I am also still on the same medication treatment that I was put on first. But because it was a crisis, and I was in a highly elevated state, they put me on a very high dose immediately and did not titrate me. Which I titrated down from that original dose. But yeah, I'm on, just for the edification of our listeners, I am on 1,000 milligrams of Depakote, which the non-brand name is divolprax sodium, and then I'm also on 7.5 milligrams of Zyprexa, which is also called olanzapine.
So, Manon, what exactly is Depakote and Zyprexa?
So, Depakote, aka divalproex sodium, is also an anti-seizure medication, and it basically works to treat both the manic side of bipolar as well as the treatment of seizures by restoring the balance of certain neurotransmitters in the brain. And I take a whole lot of it. It has a whole bunch of side effects, including possible fertility issues, weight gain, and a whole host of others. But it was the first thing they put me on, and it worked. So I decided, if it ain't broke, don't fix it. And then for Zyprexa, it is an antipsychotic, and it is used to treat both bipolar 1 and schizophrenia, which is interesting when we get into our talk about how these disorders should be classified. But that is also kind of used to restore the serotonin and dopamine levels in the brain. And as we talked about previously, excess serotonin is not good for bipolar people or for people with schizophrenia. It also has some side effects like drowsiness. That's the number one. Because serotonin and other neurotransmitters that it regulates are what help keep you awake. So you kind of, I'm a very sleepy guy all the time. So, Haley, will you help me with the pronunciation?
Lamictal or lamotrigine.
Thank you.
So it's also a anti-seizure medication, and it works by decreasing abnormal electrical activity in the brain. It just comes as a little tablet, and take it once a day for me. And it has some side effects that I haven't really experienced many of, headaches, drowsiness, difficulty sleeping, shaking, or tremors. There's also a rash they tell you to look out for.
Yeah, the classic lamictal rash.
Yes, the lamictal rash.
Yeah.
They always tell you to look out for the rash, and if you get it, to stop taking Lamictal. And yeah.
So, follow-up question. Has there ever been a period where you've wondered whether your diagnosis is correct?
Yes. That is one of the most incredible things about being bipolar, in my opinion, or at least meeting other people who are bipolar, is that it's really common for people who are bipolar to question their diagnosis. So it also makes you feel less alone when you meet other people who feel the same way. Yeah. But then it makes you feel better to be no. Watch yourself. Don't question your diagnosis. But yeah, I questioned it all the time when I was first diagnosed, within the first few months, even after, especially after when my medication started working and my symptoms subsided, and I no longer felt like I was in an episode. When I was in between, I was like, it's no longer real. I'm not bipolar. They were wrong. This is too extreme of a diagnosis. This is silly. And then you tinker around with getting off your meds.
Yeah. I have never, my manic episode and the depressive episode that followed it, but especially what I experienced my manic episode was so extreme that I could never question that I should get a diagnosis that extreme. It really is the most life-changing experience I've ever had was my month-long manic episode. Because I had a full psychotic break with reality. And I believed things about the universe and about myself and about the people around me that were just totally counterfactual and so different from anything I've ever thought before in my life. And yeah, it even got to the point where like I was in such a heightened state that I don't remember a lot of what I did and said and what actually happened to me. I remember more of the hallucinations and the delusions than I remember the actual facts of what happened. So I've never been like, oh, but what if I don't have bipolar? Sometimes I wonder, we've researched a lot about like the different classifications of bipolar disorder and bipolar 1 and 2, and we, in our genome-wide association study that we kind of dove into, they talked about like how there were more polygenic risk factors associated with schizophrenia for bipolar 1 and depression for bipolar 2, but there still is a good amount of schizophrenia or like overlap with schizophrenia in bipolar 2 as well. It's just smaller. And so I do think that there are certain levels, like from what you've told me, like that hypomania still has these delusions and this altered thinking. Yeah,
like I have immense delusions of grandeur. I don't have any like visual or auditory hallucinations or anything, but I am invincible and on top of the world. I am like, I see myself as very important and better than everyone else, and that I am somehow have this greater outlook and insight onto the world around us.
Yeah. And I hope, because our listeners, we know, other than one, are a group of people in their late teens and early 20s. And I hope everyone takes this and the information they've learned here as kind of like a way to see for themselves and for the people in their lives, like, hey, this person seems like they might be a little bit manic, or this person kind of oscillates month to month between like delusions of grandeur and total depression. Like, bipolar is the time where you and your friends might be getting bipolar. So keep an eye out, and because I'm a big fan of bipolar medication.
Me too.
It works wonders.
Saves your life, you know?
It really does. Yeah, I think that's a good place to end it.
Yeah.
Signing off.
Bye.
Manon McCollum and Haley Crawford.
Bye-bye.